Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. wildhealth.com for all the information on becoming a patient or working with us.
Hey there, quick question for you. Have you enjoyed learning about precision medicine? Are you ready to expand your knowledge, incorporate genomics and epigenomics into your practice, or start a health coaching career? Wild Health's Precision Medicine Training Program is your golden ticket. And guess what? For a limited time, get $1,200 off when you enroll this month by visiting wildhealth.com/education or by emailing us directly at education@wildhealth.com. This 6-month National Board of Health and Wellness Coaching accredited program covers genetics-based healthcare and offers up to 50 AMA Category 1 CME credits. With only 2 enrollment periods annually, don't miss your chance to join us. Engaging live webinars, personalized mentoring, and hands-on training kick off next month. Secure your spot before it's too late. We cover topics including autoimmune disease, detoxification, intestinal permeability, training, nutrition, micronutrients, supplements, hundreds of SNPs, and more. Don't miss this exclusive offer of $1,200 off when you enroll this month by visiting wildhealth.com/education or emailing us at education@wildhealth.com.
Welcome to the Wild Health Podcast. I am Dr. Julie Foucher, one of the Wild Health physicians, and excited to be joined today by my colleague, Dr. Meghan Jones. Hi, Meghan.
Hey, good to be on here.
We're going to team up for a women's health Q&A. So we have been getting a lot of questions about women's health, and so we figured we would pull them together and just share our thoughts and experience on them for today with all of you. So, ready to get started, Meghan?
Yeah, let's do it.
All right. So, question number 1, I think this is a good one to start with, is what is something you wish you knew about female health or hormones earlier and why?
Well, yeah, that's a good one. I think I kind of wish I knew to almost treat them as like another vital sign. And just like how much they can, like how much light they can shed on, something that could be going on. And kind of with that, like all the things that could be affecting that. I think that all took me a while to learn.
Absolutely. I couldn't agree more. Yeah, I could not agree more. I think that the fact that I learned about what our cycles are telling us physiologically in residency, I think, maybe it wasn't even medical school, is kind of mind-blowing, considering that they're such a powerful vital sign, as you said, and can give us such a window into our health. And I feel like every teenage girl should know about this and know how to tap into that wisdom that we all have every month, because there really is a lot there. It's one of the, I think we often get frustrated about having our periods and they're this inconvenience every month.
Right.
But when you look at it this way, there's such a powerful wealth of information about our body and how we're doing.
Yeah. I think especially just like growing up in sports, like as a teenager, and just like what could we have done, right? Or
totally
done differently, for sure.
Totally. It wasn't something that I thought about at all. Or you think about them as just signs of reproduction, and it's like there's actually so much more we can learn from our periods just about our overall well-being. It's not just about fertility or reproduction. So
yes.
So we are both advocates, it sounds like, for educating more girls and women earlier about their periods and how powerful they can be. And I know that I think that this is something that I see it's being talked about more. And I think that that's coming because women are starting to understand and they're teaching their children and daughters. And there's some great groups out there. I know when I was in residency, or I think it was in medical school, I was first introduced to group called FACTS. It's called Fertility Awareness Consortium to Teach the Science. It was started by a family doctor, Marguerite Duane, who was so frustrated by this the same way that we are. And so she wanted to teach medical students and residents and doctors, because it's not something we really learn even in medical school. Right. It's often still reduced to a sign of reproduction. And we talk about all different types of birth control and how to treat certain conditions and diagnoses, often with birth control, but there isn't a lot of discussion more on using cycles as this window into our health and well-being. So we see it happening. We see more, being talked about women's health, more research going into women's health. I know there was a big announcement recently about, was it a bill that was passed basically to help do more research, including women and on women, which is a really big deal. So I think we have a brighter future ahead.
Yes. We need so much more.
Totally. So on the topic, you mentioned sports, and the next question is on cycle syncing. So this idea of adjusting either our nutrition or our workouts or lifestyle based on the phase of our cycle. So, and I know there's, a lot of discussion about this. Is it really helpful, or is it just woo-woo? And so is there evidence to support doing this? What do you think?
Yeah, I think on the topic of more research, right? Like, I think there's maybe some, like a handful of studies, but maybe not like a ton of evidence on its side yet. But I also feel like it's kind of a, fairly low risk thing that people can try and see if it makes a difference. I mean, I think there was, and I can't remember the year. I think it was like a journal, International Journal of Sports Med, I believe, that did a small study kind of looking at women just kind of like doing resistance training every 3 days versus, maybe every other day in the low hormone phase or follicular phase, and then only like once a week during luteal phase. And I did see that kind of women following like a syncing type training plan did see like a 30% increase in strength, 32, I think. So I think there's some early evidence. I think it's kind of I like to think of it though as, when I think of cycle syncing, is it's something, instead of saying like, these are things you can't do at certain times of the month, but more so, here's maybe what's going on throughout your cycle, and here are ways to help support that and help support your activity during those times. That makes sense, whether that's through modifying movement or nutrition. What do you have you found anything study wise?
I totally agree with you. I think that it's a tool, right? So I think that there's really clear evidence that just in general, we as women are not able to handle as much stress during the luteal phase of our cycle, the last 2 weeks after ovulation or before we get our period, versus in the follicular phase, the first 2 weeks, we can handle more stress. And so just the evidence for that's very clear. And so if we just operate based on that principle, then it becomes very much, like you said, an individual, and like we do at Wild Health, it's very personalized. It's very end of one experiment, right? So, and stress can come in so many different ways. So it can be the types of stress we're putting on our bodies through exercise and training. It can be the type of food we're eating. If we're doing more fasting or lower carb, that's going to put more stress on our system. It can be psychological stress. It can be cold therapy, how much sleep you're getting, all of these different things. And so I think that having that foundational understanding of how our bodies work is important to then evaluate total stress load. And I think that, there's a lot of, controversy or talk back and forth. Is this something that's really important? And like you said, this is a very low risk. These are very low risk things to try. And some of the pushback, I think, comes from the larger studies or like the meta-analyses of the literature that's out there so far, which, as you mentioned, is still pretty limited. And there's limitations to those. And again, especially when we're talking about doing things in a personalized way, when we start to look at huge groups of people, if they're not always being done in the same way, or where we're looking at all the variables, sometimes that data can can be difficult to interpret. And so I think that, operating on this principle and then looking at what is the individual situation. So if you're someone who is a recreational, athlete, you do maybe some HIIT classes a couple times a week, maybe you run, maybe you do yoga, and you're otherwise feeling good, then maybe you don't really change your training because you feel good all the time. Maybe you slightly adjust your nutrition. Like I know for me, there's a reason why we probably crave carbs more during the luteal phase. So maybe, sometimes I'll just add a little bit of extra carb, like for lunch, instead of just eggs and avocado, I'll add some gluten-free toast with some almond butter during the luteal phase. Maybe that's just psychological and placebo. I don't know, but it doesn't seem to have a lot of harm. And then maybe for an athlete who is training at a really high level, we have a professional athlete and they actually have dedicated training cycles on a monthly basis anyways. If they're able to, adjust their training to fit with their menstrual cycles, awesome. Maybe that's going to give them that little 1% or 0.5% edge, or maybe it's more, I don't know, but against their competition. And that's what they're looking for because that's their goal. So I think that, the data on the underlying sort of physiology and premise and hypothesis is very clear. Just how we use this in the individual, as always, there's a lot of nuance to it. And that's why we do things in such a personalized way with all of our patients.
I think I find myself a lot of the times I've talked about this with patients. I think and I maybe myself too, when you're first reading about it, you think of performance versus training, which I think it was Dr. Carla DiGirolamo, on one of our past podcasts, talked about performance is not training, when you're thinking about cycle syncing. So, maybe that training that we adjust, that's building this foundation. And when you need to perform, you don't have to cancel your event that's in that last week of your luteal phase,
Right, I can't compete today. The wrong day of the month.
Yeah. You're,
I've
you're going to rise to the
for
occasion. Yeah. You don't, I think that's what people think. It's I can't plan a race around my cycle per se. Right. But I think kind of differentiating for people sometimes that it's, training does not equal your performance day.
Totally. I think that's such an important distinction, right? Because some of these studies are looking at a specific performance outcome instead of doing this for months on end and the overall impact on, health or symptoms or performance. And it depends on what your outcome is too, right? I think, again, thinking about people where this might be more impactful, it could be for people who are having some cycle abnormalities. Maybe they're having heavy periods or really irregular periods. For those people, it might be more beneficial to implement some of these things. And then they can use their symptoms as a guide. Is it helping or is it not helping?
Yeah, good point. Yeah, well, kind of along the, lines of kind of nutrition and how it can fuel and things like that. I think the next question talks a little bit about kind of protein intake and building muscle. So what are kind of the top 3 recommendations you have for people, when you talk about increasing protein intake, if they maybe have a goal to put on muscle, change body composition, and kind of what are some good guidelines you give them to kind of follow and plan that out?
Well, I think that the recommendations are pretty clear now, shooting for somewhere between 0.7 and 1 grams of protein per pound of body weight per day for the average person. And for someone who's really looking to increase muscle or performance, then probably going more towards the upper end of that limit is what we want to shoot for. As far as other recommendations beyond that, I don't know if we're looking for practical things, but I think, one thing that's practical and also I think the science supports it is splitting that intake throughout the day. So for most of my patients, when we get a sense of how much protein they're taking in at first, it's usually drastically below that marker. And so often we'll have people just start with 30 grams per meal at 3 meals per day. And for some people that's in that window. For other people, there's still more to add after that. But thinking about getting a good serving of protein, 30 grams is going to be, some eggs with some additional, maybe you add some turkey or some salmon or something like that. 3 eggs with a little bit of extra protein, a chicken breast, a piece of salmon, usually that's going to be in the realm of 30 grams. So trying to shoot for that each meal, I think, is a good place to start.
I like that.
And then just in general for putting on muscle, obviously pairing that with the resistance training is going to be really important. And I would shoot for at least 3 to 4 times a week, or that being the general goal, 3 to 4 times per week for resistance training.
Right. Yeah. Do you like to, do you have a general, like, I think, I tell people like lift heavy and they're like, what's heavy, and
Totally.
Which is, again, one of those totally individualized things. So like, do you have a general rule? I find myself just kind of like giving something simple, right? Like, let's start with, say you do like let's shoot for 3 times a week, do 2 to 3 sets of 10 reps. And maybe in those 10 reps, like, you want to work toward, those last couple reps in each set, feeling pretty heavy or like feeling kind of fatigued. Do you have any other like kind of general tips or tricks when people are starting out or trying to figure out how heavy to go?
Totally. Well, I think it's all relative, right? It depends
Sure.
where you're starting from. And so I always encourage people, one, to make sure that they're working on their form first. If they haven't been doing a lot of heavy lifting like squats or deadlifts or presses, that they are working with someone who can help correct their form, or using some form of video to be able to check their form, using a YouTube video to learn how to do some of these movements. But that being most important before really increasing the load. And then we have to load progressively. So starting with something that feels pretty light, and then over time, being able to increase. So whether it's, if you pick your rep scheme, there's so many different sort of lifting plans that go by week or by month, and just picking your rep scheme and then starting at each time trying to add a little bit more weight. It doesn't have to be huge jumps, but like 5 or 10 pounds, with each set over the course of time. When I was doing a lot of my training back in the day, we used to do a lot of 7. Well, we did all kinds of things, but often we would do cycles of 7, 5, and 3. So like week 1 would be sets of 7, 5 by 7, things like squats and deadlifts and presses. And then week 2, we do 5 by 5s. Week 3, we do 5 by 3s. And then we take a week off, and then we repeat it again for several months. And so the first month is just getting a baseline and saying, okay, I can do this. Next month, maybe you add a little bit more weight, and eventually start to find your limit where, you can't complete the full set of 5 and you have to stop at 4. And then, I'm at my edge, I'm at my limit. But that takes a lot of time to build up not just the strength, but just the, all of your joints, your soft tissue to be able to withstand heavier and heavier loads. So I say start small and push it. But I do think that oftentimes people, especially women, have a tendency to undersell themselves. So it takes confidence and or it takes sticking with it and continuing to push yourself so that you're adding a little bit more weight each time, so long as your form looks good.
I love it. That's awesome.
All right. So beyond the topic of muscle, the next question is, how does muscle and prioritizing muscle growth help or impact women's hormones? I've heard having more muscle may actually help with period or PMS symptoms. Is that true? Big question.
Yeah. A lot here. I think our muscle definitely can function as a pretty big endocrine organ, right? And like, I think especially, my experience with it had been kind of more for like blood sugar metabolism, and things like that. It can just be so helpful in kind of helping our insulin sensitivity. And I'll have to be honest, like that was the first time I had not heard this, like muscle helping with period and PMS symptoms. Other than, I think of like exercise in general, and probably our process of building muscle definitely helping reduce symptoms, whether just like having endorphins and like improving our pain sensitivity, or with just like, some of our mental health symptoms around PMS and things like that, and just feeling better,
Totally.
going in, having some movement.
Totally.
Is that something you had heard before?
Yeah, I think that I think you're right. The first thing I think of is insulin sensitivity, and muscle being such an endocrine organ for balancing blood sugar, and how often, blood sugar fluctuations or insulin resistance are closely related to our PMS symptoms. And muscle can help regulate cortisol as well, which obviously is related to blood sugar. And then I also think about, this is not necessarily the muscle as much, but it's the shifting in body composition. So when you have less fat mass and more muscle mass, our fat cells actually can produce more estrogen. So, we have this enzyme aromatase in our fat cells that converts testosterone into estrogen. And so oftentimes that can lead to just higher estrogen states, which along with them can come a lot of PMS symptoms. So balancing that overall body composition in that way, I think, can help alleviate some PMS symptoms too. I think it's a great question. It's not something that I've heard asked a lot. And you think about the benefits of exercise, all the benefits of exercise, but some of those just come purely from the shift in body composition and how that impacts our metabolism, our mood, our hormones.
Yeah, that's a good point. Because you think of things of like some correlation between less fat mass or less like total body fat and increased symptoms. But has there been could someone that has very little fat mass, but like sarcopenia or very low muscle mass, would that be the same as if you had increased muscle?
Totally.
Like, what would that change? Which is why we need more research, right? For women.
Totally. So we have so many good questions to answer.
Right?
So many good questions to answer. I love it. Well, the next one's a big question. What are other ways to ease PMS symptoms? I mean, there are so many different things that we can talk about here, but what are your favorite ways when you're working with patients?
Yeah. I think some of the things we started to touch on maybe a little bit, definitely seeing that maybe some increased carbohydrates, especially around if you have like a longer or higher intensity workout, kind of in that time of PMS symptoms, like toward the end of that luteal phase. Can help with fueling for activities, but I think also helps with some of the like cravings, and maybe we have like a little increased calorie need during that time. And I think hydration as well with patients, and I think experiencing them personally, like whether that's just taking in more water, but adding in some more electrolyte replenishment too, because we can have that like little decreased plasma volume, so our circulatory system just working a little bit harder. We might lose a little bit more sodium during that time. I think those are ones that I've seen help, and some of that like maybe some moderate, like light to moderate, just movement, moderate intensity movement. Again, kind of like we talked about before, for just feeling good in our brains, but in our bodies as well, and kind of having that increase in endorphins.
Totally.
Is there any favorites you have?
Totally. I think, you hit on some of my favorites as well. And I think just thinking about it again from the perspective of, okay, during the luteal phase, when I'm having PMS symptoms, my body's not able to handle as much stress. So how can I support it more in that phase? And you already mentioned a few related to nutrition. So maybe healthier, starchy carbohydrates, obviously making sure you're still getting your protein, exercise, but maybe if you're doing a ton of high intensity exercise, maybe backing off that a little bit during the luteal phase, which is less stress on the body, making sure you're getting plenty of sleep, prioritizing your sleep during that time of the month, having a very relaxing bedtime routine. I bet this is a great time of the month to like take extra baths or just be more like do things that are more nourishing for yourself, even if it seems so simple, something like I'm going to light a candle tonight or I'm going to do some extra journaling or take an Epsom salt bath. It's another great way to increase those electrolytes. And then, for some women, especially caffeine and alcohol, they can be very sensitive to during this phase of the month and can really increase mood symptoms, sleep problems. So if you're someone, that hasn't experimented with that, that could be something to try as well. Just limiting those during the luteal phase and seeing how you feel, looking at, any metrics, whether it's sleep metrics or symptoms. Other stress relieving, like just in general, taking more time for yourself. Like if you can, it's a great time to, spend some time in nature, do some extra meditation, whatever it is that helps you be present and mindful. I think those are just general great techniques. And then supplements. I think there's a role for supplements here in some women, like definitely the electrolytes like we talked about, magnesium, sometimes B vitamins. The two that I've used most specifically for women around PMS symptoms are evening primrose oil and Vitex, which is also called chaste tree berry. And those are, promoted a lot for women's health, but I do find them to be helpful. And the evening primrose oil is a type of anti-inflammatory fat. It's GLA, so gamma linoleic acid. It's a type of omega-6 fatty acid, but it helps with, it converts into other substances that are anti-inflammatory. So that can be really helpful, especially for things like cramping or breast tenderness. And then Vitex or chaste tree berry acts more hormonally, and it can help in women who are experiencing symptoms from lower progesterone. So when they have big drops in progesterone towards the end of the luteal phase, that contribute to things like mood swings, cycle irregularities, breast tenderness. So those two are supplements that I've found to be helpful specifically for women with a lot of PMS.
I love that. Yeah, I think one of the other combos I had seen used was kind of like the magnesium and like an omega-3 fatty acid, which I think both can kind of help with that, like the kind of that prostaglandin load that's kind of causing a lot of the, like you're having like heavier menstrual cramping, things like that. And I think some people are saying it can also help with some of those like GI symptoms that could go along with that too, and GI discomfort that could be from some of that prostaglandin cascade too.
Totally.
Yeah. I liked your thought of to like, we always think of like, what can we add and what can we do to help symptoms? But I like the thought of like, what can we potentially, if possible, take off our plate
totally
during that time and just kind of reduce that allostatic load and extra burden if we can.
And it's a hard, like speaking of just, there not being a lot of research on women, but our world and our society isn't really set up taking into account women's hormones, right? Like it's one of the great gifts that we have is that we have these two phases of the month that are where we have different kind of like emphasis or focus. But most of the time, life just doesn't work that way, right? Like we're just sort of expected to be on all the time. And so I think in little ways that we can lean into that, it's very helpful and powerful. So if you can, planning ahead, like, okay, I want to schedule a massage, I'm going to try to schedule it during my luteal phase if that's practical for you. Or I'm going to, start a new project or do a lot of things like, exciting work or really push it. If you can schedule that during your follicular phase, great. If not, you can't, we can't be perfect and we can't, always have it the way that we want it. But when you can, I think that it's empowering and it's often helpful. And just then having grace for yourself too, right? Like when you're in the luteal phase and you're like feeling all the mood swings and having cramps and all the symptoms, instead of getting frustrated or down on yourself, just being like, okay, this is what's happening to my hormones and this is why. And I've definitely been one. It's like I don't know how old I am. It still sneaks up on me and I'm like, why do I feel this way? What is going on?
Yes.
You get your period and you're like, oh
like, how do I still forget that? Right. Yeah, I totally agree. It's like that nice, gentle reminder, like, oh, okay, I'm not completely a different person all of a sudden.
These are just hormones.
Totally. Yeah. I love it.
Well,
the next one here. I liked this one. What is the connection between hormones and mental health? So many.
So many. I know this is another really big question.
Yeah.
But I think like the simple way that I think about it is that they're very closely related because our hormones impact our, neurotransmitters significantly. And, the simple way I think about it is estrogen is usually going to have a very positive effect on your mood. So if you think about it, when you have higher estrogen, it affects your serotonin, which is a neurotransmitter we know that has a big impact on mood. That's why most of our antidepressants are called SSRIs, or selective serotonin reuptake inhibitors. And so as estrogen levels increase, our serotonin increases, and this is going to lead to generally feeling happier, more energy, overall, improved well-being. Progesterone levels tend to rise, kind of like I mentioned before, they rise during the first part of our luteal phase, but then towards the end, if we don't actually have fertilization, then they start to fall. And sometimes it's in that fall of the progesterone, when progesterone can be lower, that we start to experience mood symptoms like anxiety, depression, insomnia that can be really difficult. And so I try to keep it simple in that way, thinking about the impact. Okay, we have more estrogen, that's generally going to be more kind of positive mood. When we have low progesterone, that's generally going to be some of those symptoms. And sometimes it's also the relative amounts of each and how they fluctuate.
Yeah. And I think I often, not forget, right? But like as a female myself, like I often go straight to like, what's my estrogen and progesterone doing? And kind of remembering though that like our cortisol and our thyroid hormone and I think especially like when we think like a women's Q&A podcast too, right? We're like, what are our like sex hormones doing?
Yeah, totally.
But so I have to like, remind myself that let's make sure these other things are in check. And like, how does cortisol play in, and is that increasing anxiety, or someone that maybe has chronically elevated cortisol and now it's more like in a low place, depending on where that's fluctuating, having anxiety or depression symptoms, thyroid disease, having a lot of mood disorders that can come with that, especially in like low, either low or high, kind of being more towards anxiety or depression into the spectrum. But yeah, and it's kind of one of those like really fortunate, really unfortunate things that they're all connected, right? Like all of our different hormones.
Totally. It's a big web. And that's why sometimes, when we find most success when really trying to address the underlying causes, because that's going to then allow the body to balance things in the ways that they maybe are intended to be, versus trying to like play with each one and then throwing the others off. So they're all so connected and all play a big role in our mood symptoms.
Kind of along those, we maybe kind of touched a little bit on this. Any like kind of tips, tricks, recommendations you have for people that maybe have more of those like, mental health side, PMS type symptoms or like mood swing type symptoms that you found more helpful?
Totally. Well, I think it's actually a lot of the same of what we already talked about, because again, they're also related. So again, it's the fluctuations in hormones that are causing the breast tenderness and the mood symptoms. And so oftentimes we treat them the same way. But especially for mood, and it's going to be, again, it's experimentation. It's different for each person about what are the things that seem to be making the biggest difference for you. But, again, the nutrition being really important, making sure you're eating enough, making sure you're getting some carbohydrates during that phase, or not over, we still want protein and fat. We want balanced meals, but not like greatly reducing. The exercise being super important for mood symptoms, all the time, but specifically in this phase. Like I mentioned, the alcohol and caffeine for some people can be really sensitive to those for things like anxiety or insomnia or mood swings, sleep, of course. And then, just using a lot of other tools, the relaxation stuff, I think is really important. Spending time, really supporting your parasympathetic nervous system. Journaling is really helpful. All the tools that we talk about for general kind of emotional, mental well-being, I think will also apply here. And then the supplements, like I said, things like, the Vitex, I think can be really helpful for women.
Yeah.
How about you?
I would definitely just kind of second all of that. I think prioritizing the sleep for sure. I know for myself personally, like noticing like caffeine in that like second half of the cycle, right, is way different than in the first half of cycle. And then, I think the chase tree, some magnesium, and sometimes like some extra, like a B vitamin complex too, or at least, kind of, again, that individualized approach, right? If you're sometimes there's some extra like B complex vitamins can be helpful there too. And just if you can build in that maybe a little extra mindfulness time, right? Or even if it's just to remind yourself that this is part of your cycle, right? And it's not you and you're not crazy.
Exactly. If anyone takes anything away from this podcast, hopefully that's the thing.
Right?
You're not crazy.
Yeah. Yes.
So great. So great. All right. The next question is really more specific to a condition called endometriosis. So this question says, traditional doctors keep putting me on birth control or IUDs for endometriosis, and they're not bringing a lot of relief. What could a general holistic endometriosis protocol look like? Is it possible to put it into remission, or at least the symptoms into remission? So big question.
Big one.
I think just highlights again, like some of the bigger things that we were talking about, which is how so often our symptoms and around our cycles are giving us some information about our overall health. And I think the traditional approach has usually been to just use birth control as a way to regulate those symptoms, when often there's other things that we can do underlying, just to help support more balance. And sometimes doing these things, addressing underlying causes will, in some people, it will allow complete improvement of their symptoms or remission of their symptoms. In other people, they could be doing all of those things and still have symptoms. So again, this is a lot of variation person to person, because it's such a complex, endometriosis is such a complex condition, and we really don't have a great understanding of what the root causes are. I think there's some good theories and things that work in some people, but it's probably not the same root cause in every person, which is why there's such variation.
Yeah. And I feel like I've been hearing about it so much more. I just, in like a good way, that there's a lot more recognition. I think a lot more wide recognition of it, whether just in, people that have been suffering with it and providers as well. And so hopefully that will come with definitely more light and research and things like that. But yeah, it's a tough one.
Just like backing up a second, I realized we haven't really explained endometriosis. So for people listening who don't know, it is essentially where we have endometrial tissue, so normally the tissue that lines your uterus, that gets implanted around different parts around your abdominal cavity. So it could be in your intestines, it could be really anywhere, but it still then every month has that inflammatory response and can contribute to incredible pain. And is different in each person and each woman in terms of how they experience it. And it is, like you said, it's one of those conditions that often takes a very long time to diagnose, and for many stories of women being dismissed about their symptoms, or just, being put on birth control is the answer and not really being able to understand, because it is such a difficult condition to diagnose. The only true way to diagnose it is through a laparoscopy, which is a surgery. And so I think that leads to a lot of frustration, delayed, inaccurate diagnoses along the way. And our lack of understanding, like you said, we still need so much more research.
Yeah. And I think kind of similar, like it sounds like pretty much the mainstay, even with kind of more more holistic or functional approach, is still going to be like symptom maintenance as much as possible, and that remission of symptoms, but potentially not a full cure, unfortunately. And I think, like you mentioned, I think a lot of that general holistic approach is going to look pretty similar to things we've already talked about, right? Like good nutrition and good sleep and good stress reduction and things like that. I think, trying kind of some anti-inflammatory approaches. I have recently heard kind of some anecdotal evidence of people having some symptom relief with like pelvic physical therapy, some additional approaches of things like acupuncture, kind of somatic techniques, mind-body techniques, things like that. Have you had, any patients or, other folks you've heard kind of things that have helped them the most with this condition?
Yeah. Again, I think it's totally essential, right? So
Yeah.
I agree. Everything we talked about is super important. And like always, we want to start with the basics of cleaning up the diet. I think there is a theory and supporting evidence that there is some autoimmune nature to endometriosis and a relationship to this concept of intestinal permeability, or what might be referred to as leaky gut. And so it's diet, I think, is a great place to start. I've seen a lot of women that have improved their symptoms significantly with changes in their diet of just going on a very whole foods-based diet, higher protein, avoiding sugar, dairy, gluten, certain foods that they can be more sensitive to. So that's always, I think, a really big place to start. Obviously, exercise being very important, sleep, the stress reduction, like we talked about, I think is very important here as well. And like you mentioned, I've seen a lot of success with the somatic type treatments or energy type treatments like acupuncture. I think that's an awesome modality for a lot of different types of disorders with pain, but endometriosis for sure. And then the other thing is thinking about, there's also a lot of theory on the relationship between environmental toxins and endometriosis. And so thinking about, taking a close look at any possible toxin exposures. So looking at your household products, your personal care products, trying to minimize, we're all going to be exposed to toxins, but minimize exposures to toxins through, food, through things you're putting on your body, things you're using in your household. A lot of these also can act like endocrine disruptors. And so that can lead to more, estrogen dominant symptoms, which can be related to endometriosis. And then knowing that we're all exposed to these toxins, doing things to support good detox, which again goes back to diet, exercise, eating lots of nutrient rich foods, lots of cruciferous vegetables, lots of different colors, sweating. So exercising, using the sauna are great ways to support detox, and drinking plenty of water. And then N-acetylcysteine is a supplement that I use often. N-acetylcysteine and sulforaphane, I think, are great supplements to support detoxification function as well. So those are things to try. And then just like you mentioned, supplements to support reducing inflammation. So things like omega-3s, turmeric. I've seen some research on melatonin that can be helpful. I would use that on an individual basis, but higher doses of melatonin that can have more anti-inflammatory properties, and then pycnogonal, actually, which is it's often used as a nootropic, but seems to have some evidence in endometriosis as well. Oh, and the last thing I would say is low dose naltrexone. So this is a medication. So, and it's used off label, but used in very low doses. It is anti-inflammatory and can have a really big impact on both gut symptoms and pain symptoms. And so that's one that I've seen used a lot by more holistic OBGYNs for endometriosis, and have had some really incredible results. And I've used it as well. But definitely one to talk to your doctor about before, obviously, using it. But this is a great, simple question. Would you consider hormone imbalance to be a root cause or a symptom?
Yes.
Same. I think as we've talked about.
Yeah. I mean, definitely, I think dependent on context, right? I mean, you can definitely have diseases of, like, primary diseases of endocrine organs that, the mainstay of that disease is by definition a hormone imbalance. But then kind of like we talked about, like our menstrual cycle is a vital sign, right? Like we can have hormonal imbalance symptoms when our stress axis is out of whack, or when we're not fueling our bodies and our activities as well as we can, when we're not sleeping. So definitely a chicken or the egg, right? And I think you could argue too, like even, think of like, hypothyroidism or like autoimmunity causing hypothyroidism. I think you could even argue, like, could that be in some instances a symptom of another root cause that maybe tipped over that autoimmunity?
Totally.
Too many body stressors that we've talked about and things like that.
Yeah, I agree. I think that though, in general, just thinking of, it's a very sort of Eastern medicine way to think about things, or a DO way to think about things, that the body is meant to naturally be in balance. And so anytime it's out of balance, whether it's hormones or anything else, it's usually there's usually a reason. We can't, or there has to be a reason. We just are not always able to find the reason. But looking for that reason, looking for that root cause, I think is always worthwhile. And kind of chasing it down. So yeah, I think that oftentimes, we are sold this story that, that it must be my hormones that are causing all these symptoms, which oftentimes it is, but usually there's something underlying, or oftentimes there's something underlying that's causing that hormonal imbalance, which is why I love this question, because we should never just stop at the hormone imbalance. We should say, well, why? Is it, like you said, is there some condition that's causing the hormone imbalance that needs to be treated? Or is it, like we said, is it a looking at the total allostatic load or stress load that's causing this hormonal imbalance? And that comes from so many different places. And so what are those root causes, and can we address them? Which is, I think, the approach that we always try to take here. Yeah. All right. Well, for sake of time, we have a few questions left. Do you have any favorites here?
Oh gosh, they're all so big.
They are.
Such big questions.
Let's do lightning round.
Yeah. How about I did. Oh. How about this one? Should be quicker. Is perimenopause the same thing as premenopause, and does everyone go through it?
Great question, and common, confusion. It's very simple. So perimenopause or premenopause is basically any time in your life where you have cycles before you start perimenopause, before your cycles become irregular prior to menopause. So basically all of your reproductive years. versus perimenopause is that time where your cycle starts to become irregular before menopause. So no, they're not the same thing. And everyone goes through both.
Yep. And I think, that perimenopause kind of gets interchanged with menopause, which is just like the marker of you haven't had a cycle for 12 months.
Totally. Yeah. I think that's true. I would say not everybody goes through perimenopause. I guess if you have hysterectomy or, a certain condition that incites menopause, you might not experience cycle irregularities beforehand, but those are our definitions. And then on the topic of menopause, then we had two questions. One, just how do I ease stress and anxiety about aging and going through perimenopause and menopause? And what are some of the interventions for easing menopause symptoms, which I think we've touched on a lot of these already. I think the best way to ease stress and anxiety is just like we've been talking about. Now you're not crazy.
Yes,
it's normal.
Right.
And it's a normal part of our life cycle of being a woman. And just having that sort of acceptance and expectation, I think, is the most important part. Coming from someone who's not been through either.
Right.
So take that with a grain of salt.
With the disclaimer. Yeah. Yeah, I agree. I think I find, as I think forward, I find solace in there are many that have gone before us, and we get to pick all their brains and use all that collective wisdom. And I think knowing, kind of having that, the expectations, right? And then knowing that there are interventions, lifestyle and supplement and all that can ease symptoms for sure if needed.
And I love what you said about knowing they're, leaning on the wisdom of, women who've gone before us. I think that's such an important part because for so long, I think menopause was not something that was really talked about. It was just like, oh, you just get through it. But we have so much, we can lean on so much wisdom from older generations, and being able to talk about this, I think, really is important for women not feeling so alone. And so questioning themselves of am I going crazy? Is this normal? And so, it wasn't something that was talked about a lot, but I'm so excited to see that it's being talked about so much more now in the mainstream. And I think that just that sense of community and sense of normalization and, connectedness that we have as women and leaning on the older generations is really awesome.
Yeah. Love it.
And then as far as interventions, I think we've talked about all of these, all the same interventions we've already talked about. Right. Lifestyle interventions apply. I think the protein intake is extremely important during perimenopause and menopause. Insulin sensitivity or blood sugar regulation is extremely important. And then there's some slightly different supplements that you might lean towards more for that stage of life versus PMS symptoms. But everything else, I think, really still it's true that we've already talked about.
Yeah, there were a few studies I did find with correlation of increased lean body mass, or that kind of increased muscle mass, and correlating to lower frequency or intensity of vasomotor symptoms, so that your hot flashes and night sweats and things like that. So it's kind of one of those things we can think about. We could start now building our reserve there and just increasing that lean body mass, that muscle mass, and potentially have maybe some less severe symptoms there.
Totally.
And then, of course, on a case-by-case basis, and if people are appropriate and if symptoms are severe, there's always things like hormone therapy and, medications like the SSRIs and SNRIs and things like that if needed.
Totally. And last topic, just since it was asked, I think this other big question, kind of elephant in the room, is measuring hormones that we haven't addressed.
Yeah.
And, how can we see when they're out of balance? How do we know, how to approach it? And I think that's where our approach at Wild Health is so important, is gathering all that information. So whether it's, I think first, always going back to and relying on your menstrual cycle is the most important vital sign. And there's so many different signs that we can track throughout our menstrual cycle too, that give us an indication of what's happening with our hormones, with our estrogen and progesterone. So tracking temperature signs. There's other signs that you can track as well. And so that's, I think, always the most important and reliable. And then there's obviously blood testing, which we do on a lot of our patients, looking at hormone levels. So we can look at them at different phases of the cycle. And then for even more advanced testing, there's urine hormone testing. So that's where we can get even more specific and understand what's going on with women and be able to treat that in an even more precise way. So,
yeah, I think part of that question was just what are, like different protocols. And I think it's interesting, like it's still going to have that, like that pyramid of whatever protocol or treatment would still have that same foundation, I think, across the board, right? Of like our nutrition, exercise, sleep, and then start to just like kind of differ into maybe some specific supplementation or, for the person specific, micronutrient or vitamin replacement or something like that.
Totally.
Yeah.
All right. Well, this has been fun. Thanks.
Yeah.
Thanks for joining me, Meghan. And
thanks for having
see
me.
you guys next time.
See ya.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.